Hi, everybody. Welcome in. I'm going to just let everybody get situated for a second as I see all our numbers climbing. Hope everybody is having a good Saturday morning. All right, let's get started. Welcome to our latest on lupus patient conference. Normally, this conference is held at UCLA, but I think it's really a unique, and we're trying to look at the positives, but we're really able to bring people in from all over the country and all over the world today. So you're in for a real treat. We have, we're going to start out with some yoga for wellness, and then we're going to get the latest on lupus from Dr. Daniel Wallace. And we'll also be doing a Q&A. So I should let you know now, if you have questions for Dr. Wallace, please put them in the Q&A. And I'm going to be facilitating that Q&A after Dr. Wallace gives his talk. And then we're going to hear from Arnita Roberts-Christie from GSK about how to prepare for a telemedicine appointment, which obviously we're all doing a lot more of now. My name is Adam Selkowitz. I'm the chairman of Lupus LA. And I want to thank you all for being here and being a part of all of our virtual programming that we've been doing. One thing I want to tease before I forget is we're going to be launching a podcast in January. So keep checking your social media for that, but we're going to have some really amazing guests on the podcast to talk about lupus stories and how people can be really inspirational despite the challenges they face with lupus. And I think we'll be able to get a lot more in depth with some of these patients than we have been able to on either a Facebook chat or conferences like this. So it should be a unique addition to our roster. So look for that starting in January. We're also going to be doing some unique virtual fundraising events in February and over the summer. So look out for those, and please interact with us on our social media channels or send us emails with other questions. For all of the participants today, if we aren't able to answer your question, please email Catherine. We're going to be putting some information in the chat box about where you can see our participants' websites or ask them specific questions, because we really, that's our core mission, is to be there for lupus patients and their families. And any way we can help you is really what makes us happy. So I am very pleased to start out today with, I think, what will be a really helpful tool, especially during this increased stress that we're all going through with the latest COVID news, et cetera. We're going to be doing some yoga for wellness with Dena D'Angelo. And Dena actually participated in this conference in 2015. We were just talking about that. So welcome back to Dena. She's a certified yoga therapist and an Ayurvedic wellness counselor. I think I got the word right? And she has a great website, yogidyoga.com. We're going to put that in the chat. And she's worked with some of our patients for a long time. And I think you guys are really going to enjoy this. So I'm going to turn it over to you, Dena.
Thank you. Well, good morning, everybody. I'm honored to be back with you again. And I'm just going to spend a little bit of time going over a few little points of how yoga therapy can hopefully be a part of your well-being program. As a yoga therapist, what does that mean? What is a yoga therapist? That just means that I have trained far beyond the scope of a typical yoga teacher, and very specifically in the realm of therapeutic yoga, which may be a lot more appropriate for stress reduction, for things that are happening in your body with lupus and whatnot. So we often collaborate with other Western medicine professionals, and we often work with chronic pain and disease management, as well as stress reduction. So some of the benefits, just so that you know you're on the right page with this, you may have had people say to you, hey, yoga would be a great thing for you to start doing. But I would recommend that you don't jump into some hyper elevated class where people are in these crazy positions and you know, that's going to put you in a place that's not going to be comfortable. So what we're going to target is finding the benefits in the physical body. That would be keeping your joints limber, reducing stiffness, working on that range of motion, maintaining that, and then helping you with your flexibility and just to assist in some strengthening and maintaining balance. And then another aspect of yoga is not just the physical practice, but also the breath practice, which is really important. So with our breath practice, we can lower stress, we can calm the mind and our nerves, and also obviously it assists with our lung function, and it helps to lower your heart rate too. So we're going to help you out with your heart health as well. Mentally, yoga can assist with focus, and also some of that mental fog that you might be experiencing as a side effect of your medications or just whatever you're walking through at this time. It's really helpful on that level as well. And then also thinking about the emotional level, it can help us if we're feeling anxious or depressed, and it also can help us out with our coping skills. Another thing very specific to lupus that I look at to help my patients with is better sleep quality. So if we can start to integrate some of these practices in our sleep routine, perhaps you'll get some better quality sleep, which we know is going to help your health overall. Also looking at fatigue and energy level. A mindful practice can sort of awaken us up and bring that energy level up and shed some of that fatigue, okay? Other things to think about are the effects of helping with possible weight gain as a side effect of medications that you may be on, and also some gentle detox of the body. And very lastly, thinking about yoga just to support your overall immunity, which we know is really important now, okay? So the next piece I'm gonna go on to, this might be the place where you wanna take a couple notes, are the different types of yoga. And you might wanna consider what type of yoga you wanna practice according to whether you're in a maintenance period with your lupus, or if you are in a flare-up period of your lupus. So if you are in that nice little sustainable maintenance period, this would be the time that you could start up a practice with maybe doing some privates with a yoga therapist, just so that person could make a custom tailored practice for you, which could be a daily part of your wake up and stretch routine. And as things go along, maybe that would progress to another level. So if you could afford that, that is something I would recommend, working privately with a yoga therapist. And I can help you out with that. I know a lot of people that are happy to take on new clients. Also, you could look at therapeutic classes. Those are a little harder to find, but as I mentioned to the folks here that are hosting this, if you want to send me an email to pass on a little information for referrals, I can direct you to some therapeutic yoga classes, or maybe gentle hatha yoga. So that would be a note, hatha yoga, H-A-T-H-A, or therapeutic yoga. That would be in your maintenance or sustainable period. Now, if you're in a flare-up, you want to maybe look for a class that's a restorative class. So if you want to write that one down, that one specifically targets stress reduction. It helps to take us out of that flight or fight stress mode and into rest and digest, the parasympathetic nerve system. So that class is called a restorative class. I know there's a lot of good ones online. Again, if it's one taught by a yoga therapist, that's where I'm going to steer you. Third thing to look at for a yoga class might be meditation. So we can sharpen up our focus skills there. Meditation often helps us be more positive so that we can handle what we're going through on a stress level, and especially on a disease management level. And it helps to promote overall calmness as well. And then very fourthly, this is a specific class called Yoga Nidra. So that's first word yoga, second word NIDRA. That is a guided relaxation class that really helps to release physical and mental tension that we might be holding in the body. It's also really good for pain management. So I am not a specialist in the yoga nidra. I do have good people I can recommend. These same people are often teaching really helpful meditation classes. So if you're interested in that, go ahead and shoot me an email and I'll try to help you out with that. All right. So one of the other things in yoga, as we start to do some stretches today, and as you maybe go forward with finding a class, with therapeutic yoga, with all yoga in general, it is not a no pain, no gain situation. What you want to be doing is really the opposite. You want to listen to your body and foster health and body awareness. So that's going to help you out just on a daily basis. When we start to tune up those skills, we become aware of where things in our body may or may not feel good. And on the opposite side, where they do feel good. Okay, so with that, let's get started. Today, I'm going to offer a couple different ways to just get into this practice, which is just a gentle stretch. It's about keeping our joints limber. And this is stuff that you could and should do every day. Okay, so a couple options here. I'm going to just change the way we're looking at things a little bit. If you are sitting in a chair and a chair is more comfortable for you, then I'm going to offer some options in the chair. And then if you can come down onto the floor and you have a yoga mat or you have a blanket, go ahead and do that. So pick either option there. Also, if you have something that's like a big pillow or some blankets to be nice and comfortable, maybe you sit that down and come to a seated position on that. So you're going to find either of those two positions, and don't worry, I'm not going to leave out my chair people. I'm just going to start here on the floor. So find your comfortable position either in the chair or on the floor. And then I want you to see if you can softly rest your hands on your knees. And then we're just going to slow things down, and we're going to pay attention to the breath. So sometimes when we're in a stress mode, we're taking these short, shallow breaths that just end up here in the chest. And I want you to think about expanding your breath pattern so that it's really embodying the entire body. So let's come into that seated position. And I know throughout life, we've heard people say, sit up straight. So I'm going to ask you now to see if you can just sit up taller, sit up straight, and then close your eyes. And let's start to bring our awareness to the breath entering the body through our nostrils. So as you inhale, feel that breath entering through your nostrils. And just notice the spaces in the body where that inhalation inflates. And then as you let that breath go, you exhale. There might be a tendency to do that out the mouth. And let's do that for a couple times. So let's exhale out the mouth. We just notice there that that's a quick escape valve. And that can be good for stress reduction. We kind of do that normally if we're in a stressful situation. Sometimes we take a big exhale. So let's do that mindfully one more time with the eyes closed. Take a nice big full inhalation through your nostrils. Fill the body up with the breath. And then with this exhalation, we're going to once again exhale out the mouth. Now we're going to fine tune that just a little bit. So as you bring that inhalation into the body, into the nostrils, I want you to see if you can slow that inhalation down and broaden it so that you can feel it a little more fully in the body. So slow and full. And then maybe once you take that inhalation, if you can hold it for just a moment or two, then we'll start that exhalation. And this time, let's let it go out the nose and let's let that be slow and full. As slow and full as you can. And I just want you to continue with that. So nice, slow, full inhalations through the nose. If you can find a little pause at the top of the breath, that's wonderful because you can feel where that breath is in your body. And then when it's comfortable, you'll take a nice slow exhalation out the nose. And I want you to just continue with that. Think about every time you bring that inhalation into your body, you're expanding into spots that might need a little stimulation. And then as you exhale, it's our opportunity to let go some of that stress in the body. So as you exhale, naturally the body starts to soften up. So find that, become aware of that. This is a beautiful calming practice. So anytime there's too much stress, if you can carve out even 10 minutes of just this breathing, and trying to let go of any mental chatter that you might have here. Just focus on the breath and how it expands your body and how it softens as you exhale. Let's go 2 more breaths. Nice, and my 2 more breaths might be a little different than yours, and that's just fine. All right, now we're gonna gently flutter the eyes open and just notice, did you bring some calmness to your body? I don't think you can avoid that with just that breath practice, all right? So now we're going to bring a little bit of movement and range of motion into the joints. So let's just take the hands in front of us. And if you can make fists here, that's wonderful. And then we're gonna just start to rotate the fists. And I naturally go away from one another, all right? So my hands are turning away from one another, but you might not. Yours might be going the same direction, no problem. Whichever way is natural for you, take that. So you're just taking rotations through your wrists and then change directions of the wrist turns. And if this is too much on your shoulder, you can just take a bend in the elbows. Good, and then let's let that go. And we're gonna bring a little bit of range of motion into the shoulders, okay? So I'm gonna just move up here just to be with those of you who are sitting in a chair. All right, and we're still kind of maintaining that nice tall spine, but we're gonna bring some range of motion into the shoulders. So just bring the shoulders up towards your ears and then draw them back. And we create a nice little space across the front of the chest, which can get really tense. And then let the shoulders come down the back of the spine and release. So forward and up towards the ears, rolling back down nice and slow. And just continue with the breath pattern here. We're not going to assign anything special to it, but make sure that you're breathing nice and smooth in and out through the nose if you can. If you have to use your mouth, that's okay too. So just working with some nice little range of motion through the shoulders, either in your seated position, on the floor, or on the chair. Good. All right, now let's relax. So that was nice. Now we'll bring a little attention to the neck. So I like to think of the neck as our little mini spine. We're going to do a series of stretches in the neck, and then we'll do that same series of stretches through the back just to keep everything nice and limber. So sitting up nice and tall, just take an inhalation here. And then on your exhalation, you're just going to rotate your neck over to that right side. Feel that nice little stretch. Linger here for a breath. And then with the next inhalation, let's bring our gaze back to center. Inhale here. And then with an exhalation, let's take that rotation through the neck over to the left side. Let's linger here for a breath. Maybe you didn't even know you were that stiff in your neck. And then let's come back to center. And then we'll take an inhalation. We're going to take our chin upwards. We're going to stretch through the front of the throat. We're extending here. And then with an exhalation, we're gently going to bring that chin down towards the chest. Let's do that one more time. Inhaling, stretching upwards, feeling the skin in your throat. And then exhale and bring that chin down towards the chest. And then let's come back up to center. So we did 2 rotations. We did extension and flexion. You don't have to remember all this stuff. Now we're going to do some lateral movement, okay? So we're going to draw the right ear towards the right shoulder, just nice and gentle. And remember, the 2 sides might feel really different, and that's okay. You just go to where you can without pain, just to where you're feeling some stretch. Let's take a couple breaths here. Maybe closing your eyes. I love to close my eyes because then I'm not overly stimulated by the outside world. I'm really in connection with my body. And then you can either remain here if that feels good to you, or you can take your chin and gently turn it down towards your armpit. And that just kind of shifts that stretch to your back body. And let's be with that for just one more breath. And then bring your gaze back to face your camera again. And then let's sit up nice and tall and take a big inhale through the nose. And let's exhale out the mouth. Notice how my shoulders soften with that exhale. Now coming over to the other side, drawing the left ear to the left shoulder. I assist with my hand, but you don't have to. You can just take your ear that way. Remember to breathe here nice and smooth. And then if you'd like to explore taking that chin down towards your armpit and shifting that stretch slightly to the back of your body. And let's stay here just for another breath. And then bring your gaze back towards the camera and then tip up to nice and tall. All right, now we're gonna explore taking some of those same stretches to your back, okay? So you might have heard of this stretch called cat-cow. I'm gonna show it to you in a chair first. That means you could do it at work, or if you just tend to sit in your chair more than getting down on the floor, you've got an option here, okay? So I'm gonna turn the chair to the side just so you can see what we're doing with our spine. So sitting with our feet flat on the floor, starting from a nice tall spine position, and you can rest your hands on the tops of your legs. With an inhale, you're going to think about broadening through your chest and curving your low back and maybe taking that gaze slightly upwards. It doesn't have to be too much. That's an inhale. And then as you exhale, you're going to round your spine. Notice how I'm taking a little curve in my spine. I'm letting my shoulders roll forward, and then my gaze is slightly down. And all we're doing between these 2 movements, inhaling and curving the back and taking it upwards, is finding some extension and flexion through the spine. We're stimulating some blood flow in the spine. And then exhale and round. And go ahead and continue with that if you're in the chair. And then I'm going to show you how to do that on the floor. So if you are on the floor, you can come to your hands and knees. You can place your knees on a blanket if the knee joints are kind of tender, but you're going to find a very traditional yoga cat-cow here. So hands are flat on the floor, tops of feet are flat on the floor if you can, and it's the same thing that you just saw. You're going to inhale, bring your heart center forward and curve your back. Look at that nice little curve in my back. And then as I exhale, I'm going to bring my core. We talk about that core. Bring that core up and round my spine and release the top of my head down if I can. So nice little stretch through the spine. Let's take that together a couple more times wherever you are. Inhaling, curving the spine and taking that gaze forward, just bringing blood flow to the back. And then exhale and round. One last time. Inhale, curve the spine, bring the heart center forward. And then exhale, round that back and maybe release your neck here. Good. And then if you're on the floor, let's just come to a nice neutral spine. And then come on down to a seated position again, but this time outstretched.
It's Adam. I hate to interrupt, but we're going to have to, I got to move on to Dr. Wallace in a second here. So I don't know if there's something, I'm sorry, we're on a time crunch.
That's okay. I'm so sorry.
No, not a problem at all.
Anyway, we did get some movement in there, so I can share some more things with you online.
No, I appreciate that. And I encourage everybody to reach out to Dena and check out her website, because I mean, I'm feeling much better this morning by having done this. And I understand, you know, if we were able to continue, I know our audience would appreciate it too. So thank you very much, Dena.
All right, everybody have a beautiful day.
Excellent. So we're going to move on to Dr. Daniel Wallace. We're going to get out of our relaxation mode a little bit and learn about lupus and learn about what's going on. And I'm going to bring Dan in. Dan is obviously one of our founders and one of the foremost leading experts in the world of lupus and rheumatology. And we are super lucky to have Dr. Daniel Wallace here today. And I'll turn it over to you, Dan, and then I'll facilitate. Just a reminder, if you have questions, try to put them in that Q&A box on the bottom of your screen, and I will, I see the ones in the chat also, and I'll sort of pick and choose, and we'll answer as many as we can. Dan, take it away. Dan, you might have to unmute yourself.
All right. Can you see the slide on the screen?
Yes, we don't see your picture, but we see.
Oh, it's okay. That's not relevant.
Okay, I do see the slide.
I'm having trouble figuring out how to move it forward. Let's see. Catherine, do you have any way of knowing how to move this? Oh, start the video. Okay. Let's see what happens.
You should be able to click through with your cursor.
Okay. Very good.
And we have your camera up now too, so you can see.
Okay. Well, good morning, everybody. Good afternoon, some of you. It seems like there's a little over 100 people watching this. I have, for the next 20 minutes, I will tell you what's new in lupus in 2020, the world's worst year, and what will happen in 2021, which has to be better. And please ask all your questions, and then we will have 20 more minutes on just answering all your questions. So what has happened in 2020 that is new in the way of diagnostic testing for lupus that will help in your management? And there's three things. One is now the availability of hydroxychloroquine or Plaquenil blood levels. The second is a new form of staining of the ANA, which can detect those who have real ANAs from non-lupus ANAs, and also the availability of a new blood test that is more accurate than SED rates and CRPs for example, for those who have disease activity. So hydroxychloroquine is also known as Plaquenil. And there's one commercial lab called Exogen or Avise. And there are several university labs such as Johns Hopkins and other laboratories that can measure blood levels. Now, why would we want to measure Plaquenil or hydroxychloroquine blood levels? Number one, if you come to me and you're scared to tell me you're not taking your Plaquenil, or vice versa, I could always do a blood test and say, how come you didn't tell me you're not taking your Plaquenil. We have all sorts of nice ways of saying, well, what time do you take your hydroxychloroquine? But in fact, if you don't take the drug, it won't work. And we really need to be honest and forthright with our caregivers. And also, if you're not taking it correctly, you only take it a few times a week, we can say, well, you're not feeling better because the dose is too low, because you're not taking enough. Or if one is trying to take extra pills, because that maybe I feel better when I take 3 or 4 a day, and that's very toxic, we could also determine that. The results come back usually in 2 or 3 days. Almost every rheumatology practice has access to this at either Exogen or through sending it to a reference lab such as Johns Hopkins. And just to show you how important this is work from Michelle Petrie at Johns Hopkins that shows that if we are taking 5 milligrams per kilogram, and that's the problem because hydroxychloroquine is broken down into 5 different subtypes, and certain people with ethnicities or demographic differences break down the drug to different components. So if I take 2 a day and you take 2 a day, we might have completely different blood levels. But this shows you how the blood level correlates with the doses. The next question is, does measuring a hydroxychloroquine blood level predict eye damage? And the answer is yes. And it turns out that if you have a blood level of 1,000 or less, which is the median part, the chances that you have Plaquenil eye toxicity is only 3%. Yet, if your Plaquenil levels are high, the chances that you could have eye toxicity goes up to 8%. And does it deal with how long we've been on the drug? And the answer is yes. If you've been on hydroxychloroquine for less than 5 years, you have less than 1% of having eye damage. If you've been on it for 10 years, you only have a 1.8% risk of having eye damage. But if you have been on hydroxychloroquine for 20 years, it goes up to 11%. So this is a very useful test to help guide both the doctor and the patient on how best to make this very, very important drug effective and safe. And what is the risk of blood clots related to hydroxychloroquine blood levels? And the answer is, if you're taking your hydroxychloroquine as you should, your chances of having a stroke or a clot are much less, and it's statistically significant. So that's the major one bullet with the labs. The second bullet I'm going to go over with the lab is a new blood test that autoimmune labs are doing. And that's a type of ANA called a DFS70. DFS70 stands for dense, fine, speckled 70. You may have read that up to 15 to 20% of all people have a positive ANA. And many individuals are labeled as having lupus when they don't have lupus because the ANA says, well, I'm tired and achy, I might have lupus. So several labs such as Quest, Inova, and Exogen, but not yet LabCorp, do a special test automatically after they finish doing the ANA. They do automatically, it's all automated, a special stain, and it looks for a speckling in the nucleus, which looks like a speckled donut. And if you have a ANA that's read as dense, fine, speckled, and no other antibodies are present, guess what? You don't have lupus. You could have Hashimoto's, you could have scleroderma, or just be perfectly healthy. So if you look at the slide here, this DFS will rule out lupus in people who aren't sure if they have it or not. Now, DFS 70s are seen in 7% of all ANAs. So, and there have been, again, several studies, and most of this, again, is from Johns Hopkins, correlating it with other autoantibodies. And if you have only a DFS 70 in a pattern of the ANA and nothing else, the chances that this is lupus is less than 1%. So this is a very, very useful test. I don't want to give you medicine if you don't need it or it's potentially dangerous. All right, the third new blood test that's very useful is from a lab called Exogen or Avise, which most rheumatologists and university centers have access to. And that is that this particular test is replacing complements. If we have low complements, we might have more active lupus. Well, if we have high complements, we have more active lupus. But this doesn't really take into account complement levels, don't take into account how much complement is made, how much complement is used up. And we have, several groups have shown that if on the surface of your red cell, you have components of degenerated complement, that means the disease is very, very active. And not only that, but we can tell by measuring the EC4D, which is erythrocyte or red cell C4D, how active the disease is. And just like a SED rate or a CRP or the other complements, this is more accurate. BC4Ds, or complement components on the surface of the B cell, means that you have an autoimmune disease, but it doesn't tell you how active. And just in the last year, there's been the introduction of PC4D, which is platelet-derived complement. And this correlates very, very highly with your risk of having a blood clot. So this is an extremely valuable and important test that your rheumatologist can obtain that can provide you with information. If the EC4D is normal, there's no point in following it. If you already know you have an autoimmune disease, you don't need to do the B. But if you want to know risks for blood clots, you can do the P. So that's just some of the newer tests. Now, let's talk about treatment. What has become available in 2020 or will be available in 2021 in the last year that's improved our armamentarium of lupus? So let's first start with topical treatments. Voltaren gel or diclofenac gel was always available as a prescription, very expensive, but in June, it became available over the counter and the price tremendously dropped. So this is an extremely useful topical. And the reason why it's so useful is that people say, well, because of my stomach, because of my kidney, because of my liver, I've been told not to take Advil. I've been told not to take ibuprofen or Aleve. But these particular agents are only 6% absorbed into the bloodstream. And most pain is in the hands or feet or locally in the knees. And if you apply the gel, and you have to do it 4 times a day to the area that hurts, it's almost as good. In fact, this drug is so safe that the American Association of Orthopedics, the American Association of Hand Surgeons, and the American College of Rheumatology in the last year has stated that topical non-steroidal gels are the first-line treatment of choice for hand and foot and other musculoskeletal pain. Now, a day doesn't go by when a patient asks me about CBD or the cannabis derivatives or medical marijuana. And what we are now learning in the last 2 or 3 years is that cannabidiol, which is what is in cannabis, is broken down to 125 different metabolites. So the question is, can I use the gummy? Can I use the oil? Can I use this? Can I smoke it? And the answer is, is that there are now published studies in scleroderma, dermatomyositis, a few small scale in lupus, suggesting that CBD has anti-inflammatory properties that may improve pain and anxiety and improve sleep and spasm, and it's safe. However, it's not regulated by the FDA, so every batch is a little different. Many of the medical marijuana stores put varying amounts of THC, which is tetrahydrocannabinol, into the CBD. This is not safe. It is dangerous. It is psychoactive. It can be harmful in autoimmune patients, and none of these are regulated. So, in answer to the question about medical cannabinoids, no THC, but if you use CBD topically, like you would Voltaren gel, it does have a therapeutic effect. And this is what we've been finding out in the last, in the last few days. But there are still 19 states where marijuana is illegal. The House of Representatives yesterday voted to legalize and decriminalize it, but it will get nowhere, unfortunately, in the Senate. Now, let's go to the last part. What new drugs or new indications will appear for lupus in 2021? And it's not one, not two, not three, but believe it or not, 4 drugs. So we're going to talk a little about each of these. And here we go. Many of you have heard of a drug called cyclosporin. Cyclosporin has been on the market for 30 years. As Restasis, it's used as an eye drop. It's approved for psoriasis. It's approved for rheumatoid arthritis. But it has some side effects that can affect the kidney and liver with long-term use. And also, it can raise blood pressure and cause a lot of chafing. A group of scientists has put together a one molecule change in the cyclosporin molecule and has renamed it voclosporin, where the dosing is the same all the time. It doesn't raise blood sugar, doesn't cause the chelosis, doesn't cause high blood pressure. It's been used in people with dry eye. There's a few studies going on, but from lupus point of view, it's been studied in lupus with kidney involvement. So the Aurora trial, which was presented at the American College of Rheumatology a few weeks ago, if you know statistics and p-values, you see that P on the last column, that means there's 999 chances in 1,000 that this data is meaningful. It put 40% of all lupus nephritis patients in remission at 1 year, compared to 22% who got placebo with steroids and Cellcept. This is a game changer. We might be able to really do something with kidney disease. Not only that, but unlike cyclophosphamide or mycophenolate, this drug appears to be safe in pregnancy and breastfeeding. And most people with lupus nephritis are young women in their 20s and 30s. So, and further, it's not even IV, it's a pill. And it's really easy to take, and it's very well tolerated. It has been fast-tracked by the FDA, and the FDA will make a decision in February whether this drug gets on the market. Now, the next drug I want to talk about is obinutuzumab. Many of our listeners here have been on rituximab, and rituximab came out in 1998, and it's approved for lymphoma and rheumatoid arthritis, and many studies have shown that it works for severe lupus. Well, obinutuzumab is made by the same company that makes rituximab, but it's different. Number one, it's 5 times stronger. Number two, it's much safer. And number three, whereas rituximab has animal protein in it, this is pure human. And the drug is already on the market for leukemia and lymphoma. So these drugs deplete B cells, and there's an increased risk of kidney failure from active lupus in the kidney. And this is a drug that does the same thing as Rituxan. It's a CD20, which is a type of B cell antibody. And obinutuzumab is a CD20 blocker, already approved for chronic lymphatic leukemia and for lymphoma. And it is bioengineered so that it blocks antibodies at 100 times the rate that rituximab does without the safety issues. But this drug is very, very strong and powerful. It's about 5 times stronger than voclosporin, which is a pill. So at the American College of Rheumatology meeting and in the New England Journal of Medicine last month, a combination of mycophenolate or CellCept with obinutuzumab was given, and they looked at the CRR, or complete renal response, and remission was found in 56% who got the drug, as opposed to 36% who just got CellCept or mycophenolate with prednisone. So and this has been fast-tracked by the FDA for the new indication. I think also in February, this drug will be approved for lupus in the kidney. The third drug you're all familiar with, it's belimumab or Benlysta. If you look at the package label for Benlysta, you will see that it says not to be used in those with kidney disease. So it's not that it didn't work in kidney disease, it was just that it was never studied in kidney disease. So the sponsors put together a trial where they took people with lupus nephritis who are on mycophenolate or cyclophosphamide and prednisone or antimalarials, and gave them, half got belimumab and half didn't, and they were studied for 2 years. And 43% achieved a complete renal remission, whereas only a third without it did. So this is consistent with the belimumab studies. And one of the things about belimumab is it has been given to over 100,000 people since it was approved in March 2011 with an excellent safety profile. The FDA is meeting in 10 days on whether to approve this for lupus nephritis. And so hopefully this drug, which is very kind and gentle, will be approved. I think it's sort of in the potency range of voclosporin, which is a pill. This is a shot every week or an IV. And I think this will be a game changer. You know, everybody on dialysis costs the government $120,000 a year, not counting the hospitalizations, all having to go to dialysis, having to, all the modifications with diets and everything else. If we could just give you a pill or a shot, it would be nothing more than amazing to improving your quality of life, your independence, socialization skills, self-esteem, and everything else if we can treat it this easily. And this is the belimumab study. That they didn't just do it for 6 months, a year, they did it actually for 2 years. And again, if you look at the last column, you will see that the p-value is 0.03, meaning only 3 chances in 1,000 that the result was wrong. So this is really, really amazing. And I didn't put in the anifrolumab slides. I'm sorry. So let me talk about the fourth drug, which is not for nephritis, but it is a drug called anifrolumab, and it is an agent that treats skin lupus and musculoskeletal lupus. And it is been very effective, and another article in the New England Journal last month showed that it works. And this particular agent is now being fast-tracked by the FDA, and we think by February or March, this drug will be approved for lupus. It's a shot, it's a subcutaneous injection. And then finally, there are drugs that are already on the market that are not approved for lupus, but if your doctor is very resourceful, he or she can get it approved for lupus. So let me just mention some of these. Number one is the use of tacrolimus or tacrolimus. We're using it now for patients who have kidney disease and have had a kidney transplant. And it also is safe with pregnancy and breastfeeding. It also is available as a topical cream for lupus rashes. It's called Protopic. You may have heard of it. And these are already available. Since these drugs are generic, they are not being studied for SLE per se, but under many health plans, since they're not all that expensive, they are approved. What are some of the other drugs that are on the market that can be used for lupus? And some of these are very easy to do. One is a drug called NAC, which has been out since 1965, over the counter, and it is called N-acetylcysteine. It's also called Mucomyst. It's for people who have asthma or a cough, and it's for bronchospasm. But it seems to do something with the cell surface receptor that improves lupus. This drug is very cheap. Make a long story short, the National Institute of Health has just granted in the last 2 months a $12 million grant to 16 centers to try this over-the-counter pill for lupus. We are one of the 16 centers. If you're interested in trying this in a controlled setting, it will start in 2 or 3 months. Let me know. Rapamycin is a derivative of NAC. It's also used in kidney transplant patients. It's similar to tacrolimus and voclosporin. It's a complicated drug, but the interesting thing is that there are several papers that suggest that this is one of the very few drugs ever developed that may slow the aging process. So I don't want to get you too excited, but nevertheless, this is several years away, but there have been 2 or 3 studies suggesting that it does help lupus. Leflunomide, or Arava, is a drug that's been on the market for rheumatoid arthritis since the 1990s, and it's about 10 cents a pill. It works in a month. It's similar to methotrexate, but it's not chemo, and you can drink alcohol with it. And it works, and it may help lupus joint disease. In the last 2-3 years, we now have oral agents for rheumatoid arthritis that are being studied for lupus. One is tofacitinib or Xeljanz, upadacitinib or Rinvoq, and baricitinib, which just got approved for COVID last week. So these are agents that are used for RA that are a pill that my office has samples of, and most offices do, and it works within a week, and it is particularly good for lupus joint and skin disease, and clinical trials are being conducted right now. So that's repurposing right now. And then finally, the biologics, anti-IL-6 or tofacitinib or Actemra or Kevzara, is being used in COVID as an anti-inflammatory. It's approved for rheumatoid arthritis and juvenile rheumatoid arthritis, and it may help lupus and scleroderma. And we talked a little before about complement activation. There are drugs now that are already on the market for other rare blood disorders. One is eculizumab, which is now being studied for lupus to block complement activation. So in summary, there's new blood testing. There's new uses of topical and CBD. There are several anti-inflammatory drugs on the market that are inexpensive that most plans will pay for, and there will be new drugs on the market. So even though 2020 was probably everybody's worst year and worst nightmare, there may be some silver lining from this. So I'm gonna stop now. I guess I'll put my mug back up on the screen or whatever you guys do that. And I am happy to answer your questions. I understand that Adam has volunteered to be the MC.
Thank you, Dan. That was incredibly informative and a lot of tongue twisters in there, but I think it's a true testament to all of the lupus scientists and researchers how different things are now than even 2, 3, 5 years ago. Just how many drugs are being studied and really impressive. And I know you do a ton of those clinical trials, and our website also has a clinical trial page now, lupusla.org. So if people are interested in clinical trials, there's a good way to find out about those opportunities. I want to try to cover as many of the COVID questions as possible, because as you can imagine, that's what's on a lot of people's minds. So I think let's start out with the studies that have been done, COVID patients in autoimmune patients, and how would a lupus patient be affected by COVID compared to others?
There have been several studies published in the last 2-3 months suggest that lupus patients are at the same risk for COVID as everybody else, and the severity of their COVID is the same as anybody else. And the ability of a lupus patient who's on a biologic or a chemo, it suggests that they can continue to take it and it doesn't really affect it. So this is very, very good. And we're learning a lot about the immune system from COVID that will be translatable to lupus.
Are there a lot of, if you're on any of these medications like Plaquenil or steroids or any of those things, does that actually help you in the COVID process? Are you ahead of the game?
Plaquenil will not make you worse. It might make you better if the study's done well enough, but we don't know. And any of the other drugs I mentioned are really that help COVID are really for lung COVID.
Mm-hmm. Vaccines. So I'll start out with a COVID vaccine, and then there was another question about the shingles vaccine. But in general, what do lupus patients have to do in order to make sure that the vaccines are safe for them to take?
The vaccines are safe. The lupus advocacy organizations have put together a $3 million effort to follow all lupus patients who get vaccines. So you will be closely monitored, but the consensus from the NIH consensus meeting 2 weeks ago was that 99% chance that nothing's going to happen. If you get a little flu or achy for a few days, live with it. As far as shingles, get Shingrix, it's a killed vaccine. Do not get Zostavax, which is a live vaccine.
Got it. And are you recommending that your patients try to get specific about the vaccines they take versus
get whatever you can?
Get whatever you can. Okay, good advice.
And get it yesterday.
Yes. Oh, that was another question was, does an autoimmune diagnosis put you in a category that will get you to closer to the head of the line?
We hope so. You know, the rules might change in 48 days when there's a new administration, but we don't know.
But we're still considered high risk.
You're not going to the whole country will have it by June. You'll be January through March.
All right, I can deal with that. All right, I have a question on the relationship between Ehlers-Danlos and mast cell activation and how they relate, or are they related to lupus?
For every 10 people who have Ehlers-Danlos or mast cell activation, only one really has it. It's a fad disease like Lyme or Epstein-Barr. It's overdiagnosed. There's a group of people who have a financial stake in unwittingly misleading people. Ehlers-Danlos has nothing to do with lupus. Some lupus patients who are very atopical or allergic might have mast cell, which is where they're very sensitive to certain environmental agents in foods. And there are diets and books on how to treat it.
Okay. We have a question about the common cold for this patient can throw her into a really terrible flare. Would the flu shot potentially do the same thing?
Very, like 1 chance in 100.
Okay. On to CBD. I actually found this interesting, what you said about THC. Is the majority of CBD products, do they have THC? Is that something you really have to be careful of, or is it rare?
Most stores sell both.
Okay.
And THC is for a high. Cannabinoid CBD is anti-inflammatory and can help you. Don't let anybody talk to you. Oh, it's just a little. You can have a psychotic reaction from THC. Okay.
And is there a safer pharmacy? Like, do you have a recommendation on where people can get the best CBD products?
Mad Men's pretty good. Ask your rheumatologist. Every rheumatologist has their own favorite.
Can CBD lower your ANA numbers?
Not studied.
Okay. Have you used Actar on lupus patients in managing a flare?
I have not, because it's almost $1 million. I used Actar in the 1970s to treat gout when I was a resident, and it was $10 a shot. Until somebody shows me that oral prednisone is not as good as Actar, I will continue to use oral prednisone. If the sponsors who make the drug show me that the melanocorticite in the Actar is superior in a human being and not in a mouse in a trial, then I will reconsider it.
Got it. What do you recommend for hair loss in lupus patients?
Avoiding stress, not pulling your hair out, having your hormones checked if you're a female in getting into menopausal state, checking your periods and your hormonal levels as well. Is for lupus, is it alopecia areata where it's spotty, or is it a downy hair where you're just losing all your hair? What other medications are you on? So these are the things that all need to be considered. I talked about tofacitinib as one of the oral agents that is being tested in lupus at the NIH. There are some compounding pharmacists that are making topical Xeljanz or tofacitinib that may be applied to the hair.
Great. Someone who's been on Plaquenil for 15 years, how does that impact the heart?
You should have an EKG every year. QT intervals measured. The chances of heart findings is like 1 in 20.
I asked, can you repeat the shingles vaccination one that you should get?
Shingrix, SHINGRIX.
Okay, we'll put that in
Walgreens or CVS.
Great.
Insurance won't pay for it. You'll have to pay a couple $100. It's 2 shots.
Got it. Okay. There was another question I saw on Plaquenil. If you have been on Plaquenil for those extended periods where it affects your eyes, what do you recommend to a patient who's been on long-term Plaquenil?
Are your doses therapeutic? Is your disease in remission? If it's not, are there alternatives that you can transition to?
Got it. Do people have to request the DF70 test for the ANA, or is that something that's automatically done?
At the labs I showed, it's automatically done.
Got it. Is the krill study still ongoing and open?
The krill oil study has been completed and the results are being analyzed.
Okay, I am just going through the rest. I think we've hit most. There's a few more specifics. I had a protein S gene with lupus, which caused blood clots. Using
protein S is the cause, is associated with antiphospholipid syndrome. It's very, very rarely a cause of people who have blood clots and lupus. Mostly it's older men who have atherosclerotic heart disease.
Got it. Is there a relationship between lupus and glaucoma?
No, there's a relationship between taking steroids and glaucoma.
Got it. All right. On that note, I think I'm trying to get, is Hashimoto's a part of the lupus family?
20% of people with Hashimoto's have an ANA and 5% of them have lupus.
All right.
And it's also associated with Sjogren's.
I think I got to as many as I could. And we'll send you we're going to send you an after list of any that I missed.
Okay, where's your lupus joke? You know, if you're the MC and not our usual guy, so you got to really.
I got to make lupus jokes.
Yes.
Yes, I should. But I'll tell you, if you can put all the list of those medications back up, and I could try to say them fast, that would be a lupus joke, because I was trying to write them down, but it's out of control.
Okay.
Better naming people in the lupus world.
Oh yeah, people pay hundreds of thousands of dollars to have branding companies think of names for these.
I know. I actually had an aunt that did that, and I helped her one summer.
Yeah.
Surge Cola. You remember that one? That was my name.
Okay. All right. Well, thank you very much.
Thanks, Dan. We really appreciate your time. Everybody I know appreciates the wisdom of Dr. Wallace, and we're going to wrap up all those other questions, and we'll get those out to the people who need them. And now I am super excited to introduce Arnita Roberts-Christie, who we found out this morning. We are both from Stamford, Connecticut. So, and went to the same private school for a little while, King Haywood Thomas, which is now just King, and it was 2 schools and now it's 1, so we are kindred spirits, and we are so happy to have the continued support of GSK. GSK has been very involved with our Your Story, Our Fight campaign, which is, the podcast is really an extension of the Your Story, Our Fight campaign, and so many other patient-related efforts that we put forth are thanks to GSK. And we're really fortunate to have Arnita here to talk to you all about how to get through these telemedicine appointments that you've all been having. So I know we're running a little bit behind, but just stick with us. We're going to keep going, and take it away, Arnita.
Thank you, Adam. And yes, it was wonderful finding kindred spirits. So in the background, you see my fireplace that's going. Well, you see a picture of a fireplace that's going as I bring you greetings from Connecticut, because that is where I live, and it is in the 30s and snowing up here. So I'm hoping that you could bring some California sunshine my way. So good afternoon, everyone. And first and foremost, I want to thank all of those on the board of directors of Lupus LA and everyone that I've had the pleasure of working with Susan and Catherine. And I want to thank you for this opportunity to allow GSK some time to talk about telehealth, telemedicine, and all of those words that there's so many different words that are attached to telehealth. And I just want to read, I was reading the other day what exactly that all means. And it's really important to understand that although although the whole country is going through something, it's important that you continue to maintain your doctor's visits and adhere to the treatment plan for your ongoing health and wellness. Some of you may feel stressed. I know I do. You may be concerned about returning to the doctor's office. And I'll talk to that a little bit at the end. But fortunately, the Centers for Disease Control and the broader healthcare community has really taken great strides in making sure that the visits that you have when you go to the physician's office is safe. And they've done a lot of different things technologically to make sure that your telehealth visit is one that is helpful to you. So let's talk about telehealth visit. You've heard it called telehealth. You may also hear it called a virtual visit. This is not new, although with COVID, we've seen that there's been a flux or influx of these type of visits, but this is not new. There has been many times, years prior to this, where doctors have been monitoring your cardiac rhythms via the telemedicine from the ambulance or the helicopter into, a computer that's in the emergency room. So this is not new, but what it is this term is given to a live two-way visual communication. And that way that communication is a way to deliver medical services remotely. And that's really what telehealth virtual visits are really called. In this COVID pandemic era that we are in, it has forced really big changes in the world of medicine. And I believe that physicians a long time ago wanted to have telemedicine, especially if you live in rural areas. However, unfortunately, it may not have been paid before, whereas now we're really, insurance companies, everyone is really taking up the banter to make sure that we are having healthcare in a safe environment. And as technology changes, so does the push to offer more services remotely. And you can have, as I said, you have patient monitoring remotely, and it reduces. So why are we doing telehealth and telemedicine? Besides the fact that our states have shut down, they've shut down our schools, they've also shut down physicians' offices, restaurants, and things like that. The reason that we're having these type of visits is really to reduce the potential for infection or the potential for transmission of infection. So there's 3 things I want you to remember. I know that you've taken great notes with Dr. Wallace, because I sure did, but I'm hoping that you'll take some notes from this presentation as well. First and foremost, make sure that you log in early. If your visit is at 12:30, make sure you're ready to log in at 12:15. Reason being is that with technology, with so many people online, that this can change. And one of the things I want to share screen, I want to bring this up as well. I thought about this. What you have in front of you is the Us and Lupus website, and I'll talk to, as I'm going through my presentation, we'll talk about where you can find some of this information on the Us and Lupus website. But number 1, log in early. Number 2, be prepared that something can go wrong. Not that it will, but there's always that opportunity that it can go wrong. And number 3, please be patient with yourself and be patient with the system. And number 4 is talking about preparation. So let's talk a little bit about preparation. What do you need? You need a dedicated, or you need a telephone line. Let's start there. You may also access telemedicine through your phone, whether it's an Android phone or an iPhone. If your physician is saying, I want you in front of a computer, you need a telephone line that has a pretty good connection to the internet. You don't necessarily need high-speed internet. It would be good if we had it, but there are some areas that do not have it. But what is really important is that you need a strong enough communication or strong enough internet that the video system will able to be transferred from your home to the physician's office. So again, you can access that video through a smartphone, through a tablet, or through your computer. The physician may ask you to download an app that their office specifically uses. And I want to make sure you also understand is that each physician office, unless they're in a group, may use a different app. So if you're going to see the rheumatologist, you may have an app for that. You're going to see the dermatologist, there may be an app for that. Your OBGYN may have a different app. So make sure in the preparation period that you are looking to see what app they want you to download for your visit. Preparation. All paperwork is usually filled out when you pre-COVID, we would go for an office visit. You'd sit in the office and you'd fill out, 3 or 4 sheets of paper. Well, now they're asking for you to do that online. So you will fill out that paperwork before you start your telehealth visit. Make sure that the physician has that paperwork, and that will help your visit go a little bit smoother. So for instance, if you're on medication, and if you've increased the medication, you've had a side effect from the medication, make sure that you have that information. Let's say you're on a specific medication that is known to increase your weight. Make sure that you take your weight before you do that. If you are a diabetic, make sure that you have your your most recent numbers for what your blood sugars have been running. Next, check in with your insurance company. Make sure that your insurance is active, because one of the things that you'll fill out on your paperwork is what is your current insurance. And we're in December, we're about ready to go into January. Sometimes insurance changes at the top of the year. Make sure that you have the most current information on your forms. Prepare like you would prepare for going into the office, even though you're receiving that visit at home. Let's say you would, some arrive a little bit early to their visit. Make sure you keep that. Make sure you log on early. Make sure you write down your questions. That is critically important. And I want to talk a little bit about journaling here for a minute. On our Us in Lupus website, you can find areas where you can download information or download sheets that you can use for journaling. The importance of journaling is making sure that you have some type of record of what you've been feeling from your last visit. And journaling can be as simple as you having a calendar on your refrigerator, you making a smiley face for when you feel good, you making a frowny face when you're not feeling well, but you're able to take that information into the physician's office with you. You can use your phone. There's a note section in your phones that you can use. Or if you're a little bit old school like me, you want to write it down on pen and paper and take that in with you as well. But the key point is make sure that you are documenting your information. You will want to double check your equipment 10 minutes before the start of your appointment. Have a pen and paper ready to take down notes. Make sure that you're able to ask questions as well as have your questions answered. Your setting, make sure that it's a quiet location. Make sure that, I've had patients tell me that they go into the closet or they go into the bathroom. Everybody's home at this time. Everybody's home. And you may just find one corner of your apartment or one corner of your home that is completely quiet. Take that corner as your place that you're going to have your visit. With the lupus, we know that there's an opportunity for lupus fog. So we may not remember everything. We may have some challenging articulating how we feel. Bring a buddy along into your corner or your private area. Bring a buddy along with you into the bathroom if you need to, or into the closet. But the whole idea is making sure that they can hear what you may not be able to hear or what you may not remember in your visit. Make sure that you are able to focus on your session. Eliminate as many distractions as possible. So again, we're logging on early. We're being prepared with pen and paper if we need to. We're making sure that all of our information is completed online. You're going to be patient with yourself. You're going to be patient with the system. We're checking our equipment. And again, the importance of monitoring your symptoms. On the Us in Lupus website, on the very far right, you'll see where it says symptoms in depth. That's where we're going to go through a number of different symptoms. And you can look again on the Us in Lupus website, look at those symptoms, look at information that is listed. A lot of it will complement the information that Dr. Wallace shared with you. Living with Lupus has different sections. There's a section on here called Connected under Living with Lupus that talks about how to help you manage your healthcare team in terms of communicating all the information that you need to communicate with them. And if you are going for an in-person visit, I want to share a couple things that you'll need to keep in mind. Physicians' offices have a different way of having their in-person visits. And so they may say, Arnita, you need to stay in your vehicle and have your phone ready, and then we'll call you up when you're able to come into the office. They may ask you to do a temperature check before you go into the office. I want to encourage you to avoid touching lots of things. If you're going into the office, avoid touching things like, if you have to touch the elevator, use your elbow to press the number that you want to use. Doorknobs, if you can, roll down your sleeve and have the sleeve touch the doorknob so you can open it that way. Credit card machines, as minimal as possible. And make sure if you have to touch something with your bare hands that you don't go to touch your face or your mouth or your nose, because we have learned that that is how one of the ways that COVID is transmitted is by we touching something, and then we're touching our face, our nose, our mouth. Be flexible, be proactive, and be kind. This is new for all of us. And although, you know, we've been in this space since March, it is still a new thing. And we're learning new avenues of what COVID does. We're learning new avenues about telehealth, telemedicine. This all can be very challenging, can all be very stressful. But as our, you know, when in the beginning of this talk, we had Dena tell us about how to stress. As you're going through this, take some deep breaths. Take some deep breaths and help yourself relax as you're going through this. So I hope that I've been giving you, I want to leave you with a story. So I have a colleague, and she did give me permission to share this. She's been a nurse for just as long as I have, which is about 34 years. And she and her husband had a telehealth visit. And she said that she logged in early, and as soon as she logged in, the computer screen froze. So be prepared for something like that happens. Her doctor office had given her one app to download, and then the app wasn't working. This is the benefit of logging in, so you can see that this happens up front. Have someone who's tech savvy. If you have kids, they are great. I call on my 20-year-old son all the time to help me with technological issues. Important, don't panic. If something happens, you've logged in early, it's not going through, call the office and tell them, this is what's happening to me. Again, be prepared, log in early, be prepared that something can happen, and then be patient with yourself and be patient with the system. So again, this is our website, usandlupus.com. If you haven't seen the website, I encourage you to visit the Facebook community, visit the Instagram community. Again, my name is Arnita Christie, and I thank you for your time.
Thanks so much, Arnita.
You're
I
welcome.
appreciate it. We all appreciate it. That was incredibly informative. And that concludes our program today. Thank you, all of you who joined us. We had over 100 people or 100 computers. So lots more people than that probably. So thank you all. Again, if you didn't have your question answered, we will try to do that. But feel free to reach out to us through our website at lupusla.org or through our social media channels. We really do appreciate the communication we're able to have with our patients and their families. So don't hesitate to reach out to us, and have a great rest of your weekend. Please stay safe and healthy, and wear a mask and all of the things that we all know we're supposed to do. Thanks very much.
Bye. Thank you.